Hello, everyone. I'm sending greetings to all my colleagues, to all my friends all over the world, to all those who I know and who I don't know, and I'm sure that we will meet each other for sure in life. My name is Dr. Fidan Aliyeva. I'm an orthodontist from Azerbaijan, and this this is a true honor for me to be the part of this webinar series. And this topic about women in ortho, about women finding a balance in their life, in their career, is so close to my heart. I hope that you will enjoy this hour we will spend together. And let's start. Okay, so the country I came from is Azerbaijan. I do live right now here. I do live in the capital city of Azerbaijan. The name is Baku. Azerbaijan is a country with a rich cultural heritage. In our society, family values are very strong, and because of it, sometimes women carry double responsibilities. They always want to be excelling in their professional life, and also they want to be deeply devoted into their families. And growing up in this environment teach me something, gave me something. For example, resilience, adaptability, and the importance of harmony in everything we do. I believe that our profession orthodontics is not about only about teeth and mechanics. Of course, it is. Yeah, it's important part, but I think that it's about people. It's about relationship between them, and it's about the way we choose to live our lives. And this understanding came to me not from only from education, but also from the society, from my country, from my roots. Today, I want to share with you my journey. I want to share with you my experience and some lessons I have and some systems I created to have that balance. And I would love to, it will be I think the greatest thing for me if at the end of this session you will feel encouraged and empowered, knowing that you are not alone having those questions and facing the troubles we have like every day. I believe that the success in orthodontics is never individual. At home, I'm a mother. This is my kids. This is the picture we've done like a couple of weeks ago when we went on holidays. And the motherhood is the experience that gave me patience, that gave me empathy, that gave me resilience. All those things I I bring to my work every single day. This is my kids. I have a daughter, she's 5 years old, and I have a son, he's 11. Being a mother is the source for me that make me constantly grow, and it gives me energy to to go forward. I don't, as a mother, as a woman, I don't follow the philosophy that I must sacrifice my life for my children. Often society often attach that sacrificial role to parents, but instead, I choose to be better for by choosing a happy life, a meaningful life. I believe that the best experience I can give them is by my example. And I remember that once I heard the interview, the psychologists were interviewing the parents and asking them if they can die for those kids, for their kids. They just don't even think a couple of seconds. They just answer yes. And it's so easy for us to die for them. But when they ask, would you choose live happily, do your choices in your life for them? It makes all those people think before they answer. So it's about our choice, I think. Let's continue. This is my team. This is the people whom with I share my everyday work life. Professionally, I work in clinic in Baku, And together with these beautiful ladies, we function as a team. We support each other. We sharing knowledges. We exchanging knowledges. We're creating together a professional environment where doctors, assistants, and patients feel safe. They feel home. Um, my teamwork is also the source of energy for me to create, to do my job with the love every single day. I do believe that the atmosphere you have in your clinic with your colleagues always affect to the patients. It's effect of what they feel when they enter, and this is important thing to have a healthy and supporting atmosphere between each other. Okay, let me tell you about my education. I graduated my dental degree from in Azerbaijan Medical University in 2010. And at that time, orthodontics in Azerbaijan wasn't like, it was still forming as a specialty. And to find something else, there was limited resources for that. And I started to look outward for knowledge and was the most important for inspiration. I traveled abroad and I joined international courses, a lot of hand-on courses, and I met a lot of mentors who gave me vision and direction. But there is two people, two Algerian guys that completely changed my world when I met them. This is Dr. Ilyas Tibau and Dr. Vasim Bouzid. After meeting them, my whole universe just changed and never come back. I'm happy that that day was in my life, and after meeting them, I fell in love with the philosophy. I decided that I was study Pittsmaster, and the Pittsmaster itself for me was the turning point. It gave me philosophy, it gave me community, it shaped my practice completely. Later, even I had a chance to teach it in my country. I was teaching at an institute and university in Azerbaijan. I will share with you later in our presentation. Okay, and this is the day when we finished the Pittsmaster, and we made this video with Dr. Tom Pitts. I want to share with you. We really did it. It was 2 years filled of, challenges, knowledges, emotions, relations. It was beautiful. For me, this program it was about people. It was about mentors. It was about colleagues. It was about friendship we built with each other. It gave me not only knowledges for sure. Of course, it gave me like different philosophy and it shaped my practice, but I earned much more. We studied together and we worked on cases. We shared our lives. That was beautiful. And I returned home. So with much more than just clinical skills, I came back with a new vision and with a new confidence, with a new understanding that I have global big family in my life. And being a Pitts master, it's not just a title, it's the way of thinking, it's the way of living. And I will always proud to belong to this community. And as I told you, we were not only learning the ortho, also there was sites that was helpful, for example, for me to create my practice, to create myself as a personal brand. This was the marketing part and the importance of having a personal brand. There is a way you can create it, and there is a way you can share it. For me, the social media was the instrument which I used to create my personal brand. And the social media is not only work. For me, it's a really space of my expression and my art. All the videos I love to do. I do them by myself.
I love somewhere, somewhere, another can be. But today is in for it, it is tragic.
It's an important part of identity, uh, personal brand and outreach. And through social media, I share orthodontics, I share my philosophy, I share inspiration. And becoming an OC influencer gave me a different visibility, but also it gave me responsibility to educate, to connect to other doctors, and to motivate others. For me, as I said, social media is not only the professional tool, it's also the form of my self expression. It's like an art, a creative outlet that help me process, that reflect, and stay mentally balanced. Just like ortho, it's transforming smiles. I think also art transforming spirit. This is the place I feed myself. And there is a way you can create your, for example, some of the social media pages or accounts. I choose the one where I decided that I will stay myself, and I won't use some borders that created by someone that I should fit into them. No, I decided to be myself, and there is a different edges of me as a mother, as a doctor, as a friend, what I share in my everyday life. And what is the most important thing? Personal brand and social media as a tool is more effective when you know your authenticity. It's about showing who you really are, and it's always more attractive. And now, this is my new stage, the place where I'm proud to be. I'm proud to stay at the same page with all those people. And now, when my work become more global, as a Pitmaster and OC influencer, I have the chance to learn from colleagues all over the world and to share my own experience with them. This is a beautiful place where I can stay connected to my Azerbaijani heritage and also learn from international perspective. This is beautiful about the nowadays world, and it also helps me to grow step by step. I hope to bring more value both at home and beyond in my country. Okay, let's come back to our topic and ask ourselves what is really mean to be a woman in orthodontics today. Beyond individual stories of us, what is our collective experience, the challenges and the strengths we bring in our profession as a woman? In this section, I will share with what is really meant for me and for many women to enter and grow in orthodontics. The challenges, the difference I noticed between home and abroad, and some relevant data about 25 year that shows where we stand today as a woman. This beautiful picture shows really the important thing in my life I've experienced when I saw the shining stars as a woman, and it gave me a lot of inspiration. Early in my career, I noticed that being a woman in orthodontics came with some unique challenges. In my culture, for example, people are often more inclined to trust male doctors, partly because usually men do not take, for example, career break to give a birth and to do something else, and they work continuously from the day they graduate, and this created a perception that They have greater stability, they have more experience on this side. Okay, logically, it could be like this. But this point was for me a personal struggle. Sometimes I was asking myself, am I doing enough? Am I enough at all? And it was always hard to notice my own progress because there was a lot of situation when you wanted to compare yourself with someone else. And when I stopped doing this, and when I stopped fully see my achievement, but it become much easier, learning to recognize growth and to give myself credits. It become an important step in building confidence. At the same time, providing confidence meant I had to be over prepared. I have to show results earlier and perfect, and I have to demonstrate my ability in ways I went beyond stereotypes. These experiences really shaped me. And I know that many women in different countries, they may relate to this feeling. When I began traveling abroad, there also was the turning point for me. I remember when I was first, I don't know, in like 2015, 2016, in it was Vienna, I think. I saw women lectures, and I remember how I was shocked by this and how I get inspiration from that. And it was like my whole world changed, and I started to understand something more about the world and orthodontics itself. And at the same time, while studying in Pitts Master, I also had significant role models of women who were inspired me. One of them was our teacher, Sabrina Huang. She was it was amazing for me the way she teach, the way she lead and share her knowledges with confidence and was powerful. It meant a lot for me as a woman to see this. And this gave me energy and vision. They showed me that women can not only practice orthodontics at the highest level, but they can also stand at the front of the room, guiding others. This inspiration is something I brought back with me, and it continues to fuel my work today. Let's look at the statistics that makes me beautifully shocked. If you will look at the numbers, as a 2025, nearly more than 50% of practicing orthodontists is under 40. In North America, are women. It's a significant shift from just 2 to 15% through 2 decades. This is amazingly fast and speedy. Globally, like in countries as the US, Canada, Australia, and several parts of Europe, the report gender parity of female majority cohorts in ortho education. Studies show that female orthodontists are more likely to incorporate aesthetic treatment goals as our philosophy do, as Pitt's philosophy do, and also the soft tissue driven planning aligning well with system like Pitt's 21 that prioritize facial balance and smile design. This is the thing women can do better, I think. The increasing presence of women in orthodontics reshaping the profession, not only in how care is delivered, but how practices are built, teams are led, and aesthetic are prioritized. This shift reflects broader social change and highlight the need on ongoing support, mentorship, and visibility for female orthodontic professionals worldwide. If you will look at the second part, where the leadership and speaker numbers is about 24, I think this is the place we will work together all to change those numbers. So this is very nice to see the statistics. Okay, I remember that when I was at the time of struggling, when I was comparing myself with a successful man, I decided to change my vision to the world, to change my vision to the situation. And the one of the things that I started to do, because I had female mentors that were supporting me a lot through this. I understand that the world is not working this way, and I started to see what I am as a woman can bring into the ortho, into my practice. And despite the challenges, women bring immense strengths also. One of them is empathy. Empathy toward patients that help us to build the trust. Build trust is very important in orthodontics because we have a long way with them to go, and patients should understand that you are the doctor of like we are each other, patient and doctor, and this empathy is important, I think, in orthodontics, like in medicine at all. The second thing is attention to details and precision. This is something we have, and what this is something that improve our outcomes. The next thing is communication and collaboration. Communication and collaboration are areas where many women naturally excel. Just from working with teams to speaking with patients, I think the communication skill of my were, improving at the ages of the small ages of my kids when I, should ask them to do something at 3 years where they don't want to do anything, at least, to wear some jacket or something. And you have to do your best to communicate with them that way so they will do the thing they should. And the last thing is innovation via adaptation. Adaptability is the power tool to clinical efficiency, I think. Now we have to, like, we have a skill to adapt with limited sources and to having balancing roles. Innovation becomes a part of work, we work of necessity. And as we move forward, I hope you feel empowered not just by overcoming, but by what overcoming gives you, the clarity, the purpose, the community. And next, we will dive into how we can work life balance with practical system and with support us every day. I ask AI to create the picture of woman, of me, who had the different parts of life. And it was, I said that I'm a mother, I said that I'm a woman, and I'm an orthodontist. I have some social life, I have kids. And this is the picture they gave me. I wish I had that much hands. It will be helpful, I think, but the reality is completely different. And we have to do something to deal with all the parts of our life and still have some balance. In this section, I will honestly talk about the reality of balance. It's not about me looking perfect. It's not about perfection at all. It's about building systems. It's about nurturing yourself. It's about having the right support, the right community. My daily structure is essential. What I do is I plan my calendar carefully. I plan it not only for patient care, I plan it also for my children. I do have some hours which I hold for them, and when I'm completely with them, with nothing else, with no gadgets, with no patient, with no work, and I really protect those hours. Also, I learn to plan the main thing of my life in advance. This is something that helped me to be effective every day. This is the activities I love. This is the thing that recharge me. I'm sure that when something not into my calendar, there is a high chance that this will not happen. So if we will summarize it, balance start with a structure. Let's listen this together.
Everybody's so focused on growing their income. Your income happens on the inside. See, we got duped to think that our income was on the outside. That's outcome. Income, outcome. You want to produce more outcome, but in order to produce more outcome, I have to increase my income. What is my income? My self-worth, my self-acceptance, my self-esteem, my self-validation. Anything that starts with self will be income. The money or the physical thing is the outcome. So stop trying to produce more outcome without increasing your income, because here's the reality of it. Once you increase your income, you'll say, I'm not selling for less. So you're not going to be okay with this. And now guess what? You just upped your earning potential because you've increased your income. That's it. The inside will always come first. Just focus on the inside. You do not have to worry about the outside. And guess what? Your outside will be in direct relation to your inside.
I think that's true thing. For me, balance is not luck and it's not perfection. As I said, it's something we create with structure, with rituals, with self-care, and with support of people around. As the way you give support to someone, you have to be able to ask support for yourself when you need it. And clinical efficiency, of course, plays a big role in our balance too. And being in Pete's philosophy, also the big help for me that creates my whole balance picture. And to and to avoid burnouts, I focused not only on time management and also nourishing my inner state. Every week I schedule resid activities, this vocal lesson, a session with my psychologist. It's a sport, it's a social time with my friends, and even creating content for social media works as an art therapy for me. And the balance also for a woman is also biological. Our hormonal cycles changing several times a month, and I've learned to be gentle with myself to those phases, not to demand to give the same energy every day, and to respect my body rhythm. When I align my work and I self-care with these cycles, I feel really stronger and more in harmony. Balance in work is impossible also. Because without balance at work, we will feel imbalanced, and having the Pitt's philosophy as the main philosophy in my work, like as the only philosophy at my work, helped me to have a harmony also at my practical life. And today I will show you the turning point of me as a orthodontist that helped me to truly believe the system I was working. I will show you the case of my patient. Her name is Rosa, as a Rose. She's 30 years old, young lady, and she has a class 2, dental class 2 and deep bite problems. And the thing was that she has generalized periodontal issues. Let's look at the case closer. Okay, first we will look at the initial facial recourse. This is what we do in Pitt's philosophy. We look when we see the macroaesthetic, we look to the face. So there is this thing, we feel like we can see the unharmony in her face. We can see the lower third, the early wrinkles she has. She's just 30 years old, and we can see the smile that looks like do not belong to the lady that is 30 years old. It looks older than she. Then later we will do the smile diagnostics using the Pitt's protocol templates. There is things that we take in account when we create a philosophy and we do the diagnostics. For example, here on this slide, we see where is the gingival display of this patient, where is the papillary line, where does she has a smile arch protection, does she has a curve of smile or not, is there any buccal corridors or not. If we will look at all these things, we will see the smile arch is not nice. She has a flat smile, that papillary line is higher, gingival display is not visible at all, but for a woman it's nice to see at least 1 to 2 millimeter. She has buccal corridors, and she looks really older than she is. Okay, on this slide, we put on the template, we can understand how much wider her smile could be, how much dental expanding we can do with her. And here also we will diagnose her smile arch from the buccal side, the occlusal plane, and the width of upper arch wire. We can see that it's narrow. Also we can see from the sides, I don't know if you will see my mouse movement, I think no. On the side of the buccal side we can see some extra tissues. So this is the sign for us, if we are not able to do the CBCT, to understand that we are able to expand a little bit her smile, her arch wire. This is the initial x-rays of this lady, showing us the numbers. I didn't put them here, but later you will see on another slide, showing me that she has a leak in a posterior vertical of her face. And from the panel we can see that she has a loss of bone, generalized more in lower buccal sides at the places she chewed. This is occlusal records. On occlusal records we will see the flat occlusal plane that at the end creates a flat smile. When we don't have a stepped in normal numbers, of course, occlusal plane between 10 to 15, our smile will never look curved. It always will be flat, and it's not nice. This is her upper and lower jaw picture, and the important picture, the picture of patient in the front with open mouth, where we can see the inclination, very high lingual inclination of the patient. We can see the curve of Spee amount. We can see the amount of recession, the lack of hygiene also we can see from here. And let's see what we will do. Okay, let's just remind ourselves what is the recession and what caused it. The recession is something that happened to the patient with thin biological type, and it brings at the end to the lack of bone thickness. We have a really thin bone. There is a thing because of which that happened. There is a lot of version in like medicine, in dentistry now. One of them, they say that the traumatical brushing, periodontitis, what is that someone of them says that this is some inner health problem that create these processes. And orthodontic treatment can be a factor. Not only PIS protocol, any orthodontic treatment can be a factor that will make it worse, okay? And at this patient, it was my personal struggle. I didn't believe that having a patient with periodontal problems generalized, having it, I will still believe that I will have some aesthetic effect after my treatment. And I decided to try philosophy this way and see what will happen. Would I have like more recession than I have at the beginning of my ortho, and will I have it more than any other orthodontic treatment that other doctors do? I created my plan. In my plan, I decided to do the SAP bracket positioning. I don't know, maybe some of you not know the type of bracket positioning. Later, I will show you what is the SAP bracket positioning. And I start with the first wires with a 014 Pittsburgh Nightie wires. That time, I don't remember, it was a couple of years ago, maybe more. I didn't have plus plus, but if I do, I was using, I would love to use the plus plus wires. Here there was just broad Nightie wires. Then I decided to put biturbos on the lower sixes. Even it's a deep bite patient, and we know some rule, like when we have a deep bite patient, we don't put the biturbos on a posterior side, but this deep bite patient wasn't skeletal and she don't have that strong muscles that I was scared to lose that vertical. That's why I decided to do it this way. And plus, on the premolar side, I have a lot of lingual inclination. There wasn't any other chance for me to do it another way. And two type of early elastics. This is what we do in our philosophy. We do elastic from a day one, but the hint is that they are super soft. Here I use through the bite elastics from 45 to 16. I will show you later on the picture, and rainbow elastic. Both of them I will describe. This is the SAP bonding position. How we choose SAP or SAP plus or plus plus is depend of how much incisor we want to show at the end to our patient's smile frame. Here it wasn't zero. That's why I decided to go gentle, and plus I wasn't sure can I make it if the patient have this much recessions. That's why I was doing no accurate steps. And this is the bonding day. I have buttons on the upper sixes. That buttons has a reason. We use those buttons for through the bite elastics, class 3 through the bite elastics. And what I would do different now, when you look at my bite turbos, they're so sharpy. I think they will make them, more flat and high to hold lower sixes more stable and to help them don't have a more lingual inclination. And this is the rainbow elastic. This is something magical that happened that I use like in my everyday life. Rainbow elastics, there should be rules. It's not going to be more than 2.5 O's and 5/16. And rainbow elastic is something as an artificial lip. It's something holding the front of our patient while we're aligning with our broad arch wires from protrusion. Okay, and at the same time, there is a vector that brings our incisor more into our smile frame. Of course, for this, we have to disarticulate. Okay, on the next slide, there is a through the bite elastic mechanics. First, I will tell you the mechanics. Through the bite elastics, they are helping to change the inclination of posterior lower side to upright from mesial inclination, the lowers, and at the same time to do the arch development of upper jaw. What I do if I would meet today, I won't use it through the bite. I will make it through the bite elastics from canine to upper second premolar, but from buccal side, and I will use like double plus broad arch wires. This is how they look. This is how our bonding happening. If you will see that big step in the front of the lower and in the buccal side, it's a very big step. But even if we're having that step, the smart technique won't create you the protrusion at the end. Let's see. This is the beginning. This is how she looks at the day we did the bonding. And the next visit, this is next visit. It was 1.5 months from using the PITS philosophy. I'm not having patients like every day. I can easily ask them to come in like every month, like in 4 weeks. I can easily ask them to come like in every 6 months. So it gives you more efficiency. You can have less chair time with the patient, and you will have the same good result, good effect at the end. If you will look at the buccal pictures, photos, you will see that we start to have some changing occlusal plane. It means that in the front also we will see some curve, okay? And if you will look at this right part of the patient, you will even see the space we had just from the first wire. This is amazing about the protocol. Here I didn't skip on 1818 right after 14. I decided to do one more arch wire, 018, for a couple of weeks, and then I switched to the 1818. It was all just because some scare I have inside. Now I won't do that step. I will just jump to the next wire, 1818. And when I saw her after this couple of weeks, I look at her face. This is the important thing. This is the main thing I bring from my PITS philosophy education, that we look mostly at the face. The most important thing we treat, as Dr. Tom Pitts say, is the face. I look at her face and I see that I want to add a little bit more VID, the visibility of incisors in a display. What I can do for that, I will bond a little bit higher for this and give her a little bit more the rainbow elastics. And the next part of the treatment plan, I switched the wires to 1818. Normally, this is the second wires we use in the PITS protocol. And then when we switch to the 1818, we start to do the IPR on the lower incisor. I have the rainbow elastic because I want a little bit more my incisor to come to my display. I change the position of my biturbos. I put them on premolars because I need a little bit more vertical on the backside. And as Dr. Elias taught, when you want to resolve one problem, you do a lot of soft touches for this. I need a little bit more vertical for this. I will debond my premolars more gingival on the lower jaw, and plus I will order first order bend for extrusion. Even it's the light wire 1818, doesn't matter. Okay, let's see the progress. After she was with these wires and with this technique, she came back to my office, and this is the picture I see. I really was shocked. It was beautiful. It was more than I was waiting for the result I will have at that point, because we are very good with the deep bite resolving. We're very good at the dental arch development on the upper and at the lower at the same time. I have no protrusion on the lower, even if there was a really big curve, so it means that we have discrepancy, but we resolve it by making wider, by using wider wires and techniques as the torquing chain, as elastics too, and as a bracket torque that starts working from the second wire. This is the unique system that gives you the work of torque right from the second wire. This is like impossible. That's why you are not struggling with having side effects. I do remember, like before, when I was using the second or the third wire, even on the like traditional bracket systems, I was struggling with protrusion, and then I was using some TADs to resolve the problem with protrusion, because there is impossible to treat class 2 patients if we have some protrusion on the lower incisors. Here I was shocked, beautifully shocked with things I got at the end. And if I will look at the patient, okay, of course, yes, I do have some rebondings I still have to do. for aesthetic and a little bit more for function. But if we will look at the progress from the buccal side, if you remember the beginning of our case, it was super flat. Now we have a really nice occlusal plane that creates a nice curve of smile. And let's look at her face. We do have curve. Now it's more beautiful. These curves are continuing the lower lip line, and it gives us the different view, and it gives us it looks like it's a face of two different people. She's younger, she's more confident. I will do some last touches for her to finish the case. If you will see here, for example, there is between the canine and premolar, there is a big step on the upper jaw. I will have to make it smoother. For that, I will debone those premolars and do the final touches with her. Let's compare the profile of her before and at that time when I was doing this picture. It was third appointment, I think. And the central incisors are beautifully uprighted. It gives to the face a different beauty. And the vertical we changed also gave her youthness, like she looks younger now. It brings more harmony to her face. Okay, it was the fourth appointment. Okay, on the fourth appointment, we have more aesthetic result with a less appointment and with a gentle technique, because this patient has a really generalized recession, and I was always holding my hand on the pulse to see if everything going okay or not. This is the test I used to also encourage my patients to give them back the motivation, because after some time it happened that they are losing a motivation. This is the test. It's called Emma test. When you say the word Emma, there is the amount of upper incisor we show, and at the beginning there was no display. It gives to the patient the visibility of old face. And now when she say Emma, we can see some amount of her white display that looks so attractive. And when she realized that about herself, because she forget that the way she looked before, it gives her more motivation for continuing the treatment. Okay, the next steps of mine was to change to the last wire. In this case, my last wire was 2020 TMA. I'm not always using the stainless steel at the end. Here, for example, I didn't use it. Then I still was adding some intrusion bends to a lower incisor and canine, and extruding for the posterior side. I decided that I need a little bit more vertical for her. And I gave her the short class 2 elastics. But there is a hint. Those class 2 elastics coming from the lateral incisor to lower second premolar. Why we use it in the front? Because when we use it in the buccal side, we easily can narrow all the expansion we have done through all this treatment, okay? And I completely removed her biturbus. After she came with this kind of result, I love it. It was like very nice. I had nice contacts. I need a little bit more her to wear elastics, and it will be good because I do have some gap in the front. I just need a little bit more elastic to bring those contacts to the functional contacts. So what I've done else, I rebonded first upper premolar. It's still, if you will see, it's not in the flow beautifully. And I've done a little bit more IPR and the torquing chain and short class 2 elastics to completely set up the case. At that time, I always use the panorepo. This is the panoramic X-ray to understand which tooth should I reposition, which are not. I can see from here that I should reposition the lateral on the second segment, upper jaw. And I have to rebond the upper central and laterals. I can see it even from pano and from the picture also. It's not like harmonic. And there is a thing, what I will do now, I will do a little bit more IPR on the central, if it would be me now, because if you will see at the end, there is a little pepper spot I have, aesthetic fail mine. We are non-stop learning. Okay, after all this we done, she came with me with this kind of result. It was very nice, and we decided that we are stopping our treatment, and we find we like set the date to debond our braces. It's very good for me, because I wasn't believe myself that it's impossible to have aesthetic result like this in a patient with a huge recession with a bone loss. All the secret is in a very gentle technique, in a precision of braces, in a faster torque control we have on a system, on an early elastic, on a thing that we are always think about the face we changed. This is the arch wire progress on the lower arch and the buccal pictures. Let's see. Do we have more recession than we had it before? Or do we have more recession than we can have on other technique? But what else we have here, like different thing we have here? We do have a huge aesthetic impact on the patient's face and smile, like we not always have in a different techniques. This is the frontal, and that was the point why I'm calling this case the turning point, because there was a lot of words about thinking that Pitt's philosophy using very wide wires, it's aggressive expansion. But this case for me was the turning point for myself first, where I understand that it's not. It's really gentle. And it's the only maybe philosophy that gives us the controlled development, because we are controlling everything from the very beginning. And I want you to pay attention on the lower central incisor. This is what I was talking, that I will do a little bit more IPR to not having that pepper spot at the end. But okay, we are learning every day. And how beautifully we resolve the deep bite. Now she have more stable connections, contacts between the teeth, so it will be helpful for her periodontal issues also. And if we will look to the x-rays, we will see that we are beautifully changing the posterior facial height of the patient. We haven't ruined the position of her teeth, uppers and lowers. There is a numbers that showing me the differences between before and after, and I'm pretty happy with all the numbers I see. And when we look at the macro aesthetic of the patient, we have a different person, we have a different smile, we have a different face. She has now more harmonic, more young face. This is her smile now. It's beautiful. They look like she had some aesthetic thing done, but she just only done the aesthetic orthodontics. And the happiness she had at the end was really make me, have a wings to fly and to do my job every day more and more with more love than before. And when we will put it back to our template, we will see that the thing we were planning at the beginning, beautifully done. We have a wide, beautiful arches. We have a very nice vertical, and we have a very nice smile aesthetic progress with her. We have seen more incisors now than before. The thing that here is different, a little bit, the lip size that changed by the patient, and macro progress, the facial progress of the patient. When we see at her face, the different vertical give her different vision. And I love my job at this point so much. And we do, of course, the aesthetic pictures at the end because we both, patient and doctors, enjoy this process. And the Pitt's philosophy for me is about achieving beauty while we're respecting biology, because in this type of hard cases where we have to respect the biology so much, we have to be so careful with this, we can have this beautiful aesthetic result. And having Pitt's philosophy in my life, working with this mechanics and with these devices makes my everyday life completely different, because when I can see how people, how my patients react to their new smile, to their new selves, and how they differently feel themselves, it gives me a lot of motivation, a lot of inspiration, and the best thing for me when I see them having higher self-esteem. At that time, I understand that I'm there in my life. This is the job I have to do. I enjoy it, and it gives me back the energy that I can share later and later to my other patients. Okay, next part of our meeting is about, it's something that goes beyond the clinical part of my life. It's about leading, it's about mentoring, it's about building a community where women in orthodontics can be seen and they can be supported. This is the picture of us in Baku this May, where we're holding a conference with Dr. Duncan Brown and 4 Pitts masters from Azerbaijan. If you will look at the picture, there is mostly women. That's the thing that makes me so happy. And this is the place where I feel myself, like I understand that the support that women can give each other now are so meaningful, because there's a lot of women in our society which work as an orthodontist. And through my mentors, I've learned that mentorship is not about hierarchy. Mentorship is about giving others chance to grow and being happy for them. I remember how I was touched by Dr. Tom Pitts when he see his students doing achievements, sharing cases, and the Pitts family teach me this way, and I would love to continue sharing this experience with my country and with other doctors around the world. For a woman, leadership is something different. It looks different. It's softer. It's more intuitive. It's deeply connected to empathy. We're different. We're different people. We do have a different instruments inside of us, and we lead each other by supporting, not by controlling. And the visibility for a woman matters, because when women see other women succeed, you start to think that it's possible for you also to do that. There is a lot of power at that point. I want to share with you, through all this session today we have, through this hour together, some messages I would love you to take with you. The thing is, the first thing is the balance. Having balance in your life is really important. And you have to understand that it's not about being perfect. Even if I share with you today my experience, it not always mean that I'm that, structured and doing every single. No, sometimes we all can do. It's okay not to be always structured and have done all your things, but at least if you see the list of things, you can easily remind yourself what you have to do to feed your soul, to have more energy and to stay balanced. Efficiency means freedom, not pressure. Not always when we work a lot, we are efficient. No, there could be some big burnout that you won't be able to work, and it's more positive for you to have that balance when you can have your freedom, your time, and work. And last thing is about the leadership. If you remember those 24% we have to increase, leadership begins with authenticity. I wish each of us will see our inner soul, our inner structure, and respect it and love it. And I think only when we know who we are much more closer to be successful. I want to share with you this video. It's always touching me. I always cry when I listen to this.
Women holding things. What do women hold? The home and the family and the children and the food, the friendships, the work of the world and the work of being human, the memories and the troubles and the sorrows, and the triumphs and the love. Men do as well, but not quite in the same way. Sometimes when I'm feeling particularly happy or content, I think I can provide sustenance for legions of human beings. I can hold the entire world in my arms. Other times I can barely cross the room, and I drop my arms, frozen. There is never an end to holding, and certainly there is often the feeling of never doing enough. And then there is the next day, and the next day, and one holds on.
It's beautiful, and it's about us. Shine your light and let others find their way by it. Let's continue sharing our experiences. Let's continue our connection across countries and cultures. This is all the thing that give orthodontics its human side. And thank you for being the part of this conversation today. Thank you for being with me through this hour. I hope this talk leaves you inspired, not just as an orthodontist, but also as a woman in balance, lead and live with the purpose and with the joy. Take care with lots of love. Dr. Fidan Aliyeva. Bye-bye.